125 GDT/min. A microdrip delivers 60 GDT/ml. The formula for this dosage problem is as follows: 1000 ml divided by 8 equals 125 ml per hour. 125 times 60 equals 7500 GDT per hour. 7500 divided by 60 minutes equals 125 GTTS per minute. Content: Adult Health, Pharmacology, Category of Health Alteration, Endocrine, Integrated Processes, Nursing Process. Implementation: Client Needs, Physiological Integrity, Pharmacological and Parenteral Therapies, Cognitive Level, Application. Making nursing decisions. This is an alternate type of question included in the NCLEX-RN registered. The nurse must know how to perform math calculations. 33.1. Some herbal remedies commonly recommended for hypothyroid conditions include Equisetum arvens, Avena sativa, Centella asiatica, Coleus forskolii, and Fucus vesiculosus. This is an example of an herbal cam, a healing practice that does not fall within the realm of conventional medicine. 2. Cinnamon is a popular spice and flavoring that has shown considerable evidence of lowering blood sugar. This is an example of a cam, a healing practice that does not fall within the realm of conventional medicine. 3. Daily baby aspirin is a medically accepted practice and prescribed by medical doctors. This is not an example of a cam. 4. This is an example of a cam, a healing practice that does not fall within the realm of conventional medicine. Acupuncture is a type of traditional Chinese medicine. Chapter 8 Endocrine Management. 229 Content: Medical/surgical, Category of Health Alteration, Complementary and Alternative Therapy, Integrated Processes, Nursing Process, Implementation, Client Needs, Physiological Integrity, Pharmacological and Parenteral Therapies, Cognitive Level, Analysis. Making nursing decisions. The NCLEX-RN registered tests candidates on complementary alternative medicine, so the test taker should be knowledgeable of types of CAMs. Many clients use these along with conventional medical interventions. 34.1. This is an example of community-based nursing wherein nurses care for an individual client living in the community. 2. Community-oriented, population-focused nursing practice involves the engagement of nursing in promoting and protecting the health of populations, not individuals in the community. Therefore, this is an example of community-oriented, population-focused nursing. 3. This is an example of community-based nursing wherein nurses care for an individual client living in the community. 4. This is an example of community-based nursing wherein nurses care for an individual client living in the community. Content: Community Health, Category of Health Alteration, Endocrine, Integrated Processes, Nursing Process, Assessment, Client Needs, Safe and Effective Care Environment, Cognitive Level, Comprehension. Making nursing decisions. The test taker should note options 1, 3, and 4 all address an individual client, but option 2 is the odd man out and addresses a group of clients. This should cause the test taker to select this option as the correct answer. 35.1. The client should keep a written record of the results, but it is not priority. 2. The glucometer readings should be done in the morning when the client has not had anything to eat, but it can be done several times a day. This is not a priority. 3. Have the client demonstrate the skill to ensure the client can correctly perform the glucometer reading. This is the priority when teaching about glucometer checks. 4. Proper disposal of lancets and strips with blood on them is important, but not priority over the client demonstrating the skill. Content: Medical/surgical, Category of Health Alteration, Endocrine, Integrated Processes, Nursing Process, Implementation, Client Needs, Physiological Integrity, Pharmacological and Parenteral Therapies, Cognitive Level, Analysis. Making nursing decisions, in questions that ask the nurse to identify a priority intervention. All the options are plausible. The priority intervention when teaching the client any skill is having the client perform the skill in front of the nurse. 36.1. Acupressure applies pressure along the body's energy meridian. Applying pressure on the medial forearm helps decrease the client's feeling of nausea. 2. This client must have medical interventions and would not benefit from acupressure. 3. Sheehan syndrome is a postpartum condition of pituitary necrosis and hypopituitarism that occurs after circulatory collapse from uterine hemorrhaging. This client would not be treated with acupressure. 4. The client with hypertension needs medications and would not benefit from acupressure. Content: medical/surgical, category of health alteration, complementary and alternative medicine, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis making nursing decisions. The NCLEX-RN registered tests complementary alternative medicine, CAM, so the nurse must be familiar with the different types of activities and therapies used for clients. 37.1. Moving the staff members to another room will just allow the argument to continue. This is not the director's first intervention. 2. The nursing supervisor should intervene and listen to both staff members' concerns and attempt to help resolve the disagreement. This is the director's first intervention. 3. The director should not ask another staff member to intervene in the argument. The director should address the professional staff about unprofessional behavior. 4. The director should not act unprofessionally and correct the staff in front of everyone in the office. This should be done in private. Content: medical/surgical, category of health alteration, management, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, supervision, cognitive level, synthesis making nursing decisions. In any business, arguments should not occur among staff of any level where the customers or other staff can hear or see it. 38.1. These are signs of myxedema coma, which is characterized by subnormal temperature, hypotension, and hypoventilation. This client should be seen first by the nurse. Answers 230. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 2. The client with hypoparathyroidism is expected to have a positive Kvostek sign, therefore, the nurse should not assess this client first. 3. Hoarseness is expected for 3 to 4 days after surgery because of edema, therefore, the nurse should not assess this client first. 4. The client with diabetes insipidus has polyuria and compensates for the fluid loss by drinking great amounts of water. Therefore, the nurse should not assess this client first. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis make nursing decisions. The test taker must determine which sign/symptom is not expected for the disease process. If the sign/symptom is not expected, then the nurse should assess the client first. This type of question is determining if the nurse is knowledgeable of signs/symptoms of a variety of disease processes. 39.1, 3, 4, and 5 are correct. 1. This is an example of an activity the home health nurse would implement in the home. 2. Preoperative teaching is not an activity the home health nurse performs in the home. This is usually completed by the preoperative nurse. 3. This is an example of an activity the home health nurse would implement in the home. 4. This is an example of an activity the home health nurse would implement in the home. 5. This is an example of an activity the home health nurse would implement in the home. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, safe and effective care environment, cognitive level, analysis making nursing decisions. This is an alternate type of question included in the NCLEX-RN registered. The nurse must be able to select all the options that answer the question correctly. There are no partially correct answers. 41. The client is exhibiting Trousseau sign indicating hypoparathyroidism and is treated with 4-calcium gluconate, but it is not the nurse's first intervention. The nurse must first assess the client prior to taking any action. 2. When the UAP gives information to the nurse about a client, the nurse must first assess the client prior to taking any action. 3. The client is exhibiting signs/symptoms of hypoparathyroidism, which makes this client unstable, and the nurse should not delegate any task to the UAP for the client who is unstable. 4. The nurse will need to notify the HCP, but not prior to assessing the client first. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, synthesis making nursing decisions, anytime a nurse receives information from another staff member about a client who may be experiencing a complication, the nurse must assess the client. A nurse should not make decisions about the client's needs based on another staff member's information. 41.1. The client must need intermittent professional skilled care, such as nursing, not constant care. 2. The client does not have to have a family member living in the home to be eligible for home health care. 3. The client must be confined to the home or require a considerable and taxing amount of effort to leave the home for brief periods to be eligible for home health care. 4. The client can be referred directly from a healthcare provider's office or a long-term care facility, and clients may also request home health care for themselves. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, planning, client needs, physiological integrity, illness management, cognitive level, analysis making nursing decisions. The nurse must be knowledgeable of the areas of nursing, and how and why the client would qualify for the care. The nurse must be a resource and advocate for the client. 42.1. This is an example of meditation. 2. Imagery uses the client's mind to generate images to help have a calming effect on the body. 3. Aromatherapy, a biologically based therapy, involves the use of plants' essential oils for their beneficial effect. 4. Acupressure is a manipulative and body-based method applying finger and hand pressure to specific areas of the body. Chapter 8 Endocrine Management 231 Content: medical/surgical, category of health alteration, complementary and alternative medicine, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, therapeutic procedures, cognitive level, comprehension making nursing decisions. The NCLEX-RN registered tests complementary alternative medicine, CAM, so the nurse must be familiar with the different types of activities and therapies used for clients. 43.1. The priority intervention is to restrict fluids to help prevent weight gain, edema, or a serum sodium decline. 2. This position enhances venous return to the heart and increases left atrial filling pressure, reducing ADH release, but it is not priority over fluid restriction. 3. The edematous skin is fragile and at risk for skin breakdown, and turning every 2 hours is a pertinent intervention, but it is not priority over fluid retention. 4. The client needs oral hygiene, but it is not priority over fluid restriction. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, potential for alterations in body systems, cognitive level, analysis making nursing decisions, pH. Physiological problems have the highest priority when deciding on a course of action. The nurse should use Maslow's hierarchy of needs, and fluid and electrolyte balance is the priority. 44.1. Dyspnea and confusion are not expected in a client diagnosed with Cushing's syndrome. Therefore, this client would warrant a more experienced nurse to assess the reason for the complications. 2. The client with financial problems should be assigned to a social worker, not to a nurse. 3. A full thickness, 3rd degree, burn is the most serious burn and requires excellent assessment skills to determine whether complications are occurring. This client should be assigned to a more experienced nurse. 4. The client diagnosed with diabetic neuropathy would be expected to have pain. Therefore, this client could be assigned to a nurse new to home health nursing. The client is not exhibiting a complication or an unexpected sign/symptom. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. Make nursing decisions. When the test taker is deciding which client should be assigned to a new graduate, the most stable client should be assigned to the least experienced nurse. 45.1. The client who is 1 day postoperative transsphenoidal hypophysectomy is able to feed him or herself, therefore, this task should not be delegated. 2. The UAP is able to obtain a urine specimen from the client. This task is not assessment, teaching, evaluation, medications, or the care of an unstable client. 3. The client with myxedema coma is unstable, therefore, this task cannot be delegated. 4. The UAP cannot assess, and the client with an Addisonian crisis is not stable, therefore, this task cannot be delegated. Content, medical/surgical, category of health alteration, management, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, delegation, cognitive level, application. Making nursing decisions. This is an accept question. On. The test taker could ask which task is appropriate to delegate to the UAP. 3 options would be appropriate to delegate and 1 would not be. Remember, the nurse cannot delegate assessment, teaching, evaluation, medications, or an unstable client to the UAP. 46.1. This statement does not allow the nurses to have any input into the assignments, therefore, this is the statement of an autocratic manager. These managers use an authoritarian approach to direct the activities of others. 2. Laissez-faire managers maintain a permissive climate with little direction or control. Allowing the assistants to have total control is laissez-faire management. Supporting the assistants in front of the charge nurse is an appropriate action, but it does not address the needs of the field nurses. 3. This statement does not support a democratic leadership style. It is more autocratic. The director is going to take care of the problem. 4. Democratic managers are people-oriented and emphasize efficient group functioning. The environment is open, and communication flows both ways. Meetings to discuss concerns illustrate a democratic leadership style. Answers 232. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. Content, medical/surgical, category of health alteration, management, integrated processes, nursing process, evaluation, client needs, safe and effective care environment, management of care, cognitive level, synthesis. Making nursing decisions. There will be management questions on the NCLEX-RN registered. Concepts of management is included under the category safe and effective care environment and the subcategory management of care. 47.1. The client may be diagnosed with diabetes, but at the end of life this is not the priority nursing diagnosis. In fact, as a comfort measure, many clients are allowed to eat whatever they wish occasionally without regard to carbohydrates. 2. This is a psychosocial diagnosis and not a priority over the physiological problems. 3. The client has peripheral neuropathy, which produces shooting pain in the extremities. The priority at the end of life is to keep the client comfortable. 4. This is a psychosocial diagnosis and not a priority over the physiological problems. Content, end of life, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, physiological integrity, physiological adaptation, illness management, cognitive level, synthesis making nursing decisions. The test taker must be aware of the setting, which dictates the appropriate intervention. The hospice nurse tells the test taker that this client has a prognosis of less than 6 months to live. Comfort measures are very important at the end of life. 48.1. This type of breathing is called Cheney-Stokes respirations, a pattern of breathing characterized by alternating periods of apnea and deep rapid breathing. This is not the nurse's first intervention. 2. The nurse should notify the chaplain, but it is not the nurse's first intervention. 3. The nurse must first assess the client since the UAP gave the nurse the information. 4. The family should be contacted but not prior to assessing the client. Content: end of life, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, physiological integrity, physiological adaptation, illness management, cognitive level, synthesis making nursing decisions. Whenever any other person gives the nurse information about a client, the nurse must first assess the client prior to taking any other action. 49.1, 2, and 5 are correct. 1. This is an intervention the nurse should establish with every client. 2. Exercises with large muscles allow the release of nervous tension and restlessness. Tremors can interfere with small muscle coordination. 3. The UAP should use light coverings, not heavy covering, because the client with hyperthyroidism feels hot. 4. The client with hyperthyroidism is not terminal and there is no reason the caregiver cannot leave the client's bedside. 5. A calm, quiet, cool room should be provided because increased metabolism causes sleep disturbances and the feeling of being hot. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, physiological integrity, physiological adaptation, pathophysiology, cognitive level, analysis making nursing decisions. The test taker will have altern 8 types of questions on the NCLEX-RN registered. The test taker must select all the correct options to get the question correct. 51. This statement indicates the client understands the teaching and the client does not need more teaching. The exophthalmos that occurs with the disease allows the eyes to dry out, making them uncomfortable, and exposes the client to a risk of sclera damage. 2. The client should wear dark glasses, therefore, the client understands the teaching. 3. To maintain flexibility, the client should exercise the intraocular muscles several times a day by turning the eyes in the complete range of motion. This statement indicates the client needs more teaching. 4. The client should tape the eyes shut. Therefore, this client understands the client teaching. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis making nursing decisions. This is an accept question. 3 of the comments indicate the client understands the teaching and 1 indicates the client does not understand the teaching. These are occasionally found on the NCLEX-RN registered and are worded in this manner. The test taker must realize that the reverse of the usual is in place. A hint: if the test taker is sure more than one option is correct, then the Chapter 8 Endocrine Management 233 test taker should reread to make sure that a word or words such as inappropriate or needs more teaching have not been overlooked. 51.1. Conserving the energy of the client who is dying is an appropriate intervention and does not warrant intervention by the hospice nurse. 2. Applying lubricant to the client's dry lips and mouth is an appropriate intervention and does not warrant intervention by the hospice nurse. 3. This is a form of restraint, and the UAP cannot restrain the client in the home or in the acute care setting. This behavior warrants intervention by the nurse. 4. This is an appropriate action to help with shortness of breath or dyspnea. This action would not warrant intervention by the nurse. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, safe and effective care environment. Management of care, cognitive level, comprehension making nursing decisions, the nurse must ensure the UAP can perform any tasks delegated. It is the nurse's responsibility to demonstrate and/or teach the UAP how to perform the task, and then evaluate the task. 52.1. The LPN cannot perform assessments on new admissions. 2. The nurse cannot assign evaluation of the client's medical regime to the LPN. 3. The wound care nurse should perform care for a stage 4 pressure ulcer, not the LPN. 4. The LPN can contact medical supply companies and request durable medical equipment, DME, therefore, this is the most appropriate task to assign the LPN. Content, medical/surgical, category of health alteration, management, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, delegation, cognitive level, synthesis making nursing decisions, the nurse cannot assign assessment, teaching, evaluation, or an unstable client to the LPN in the home or in the acute care setting. 53.1. The client with hypoparathyroidism is expected to have decreased serum calcium level, therefore, the nurse would not contact the client's HCP. 2. The client with Cushing's syndrome is expected to have a urine cortisol level of 50 to 100 mcg/day, therefore, the nurse would not notify the client's HCP. 3. The client with diabetes insipidus is expected to have a low urine-specific gravity, 1.005. Therefore, the nurse would not notify the client's HCP. 4. The client diagnosed with hyperthyroidism should have a decreased TSH level, therefore, the nurse should notify the client's HCP. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential. Laboratory values, cognitive level, analysis making nursing decisions, the nurse must be knowledgeable of normal laboratory values. These values must be memorized and the nurse must be able to determine if the laboratory value is normal for the client's disease process or medications the client is taking. 54.1. The nurse would expect to administer a thyroid hormone to the client diagnosed with hypothyroidism. 2. Metformin must be held 24 hours after a client has received any type of contrast dye, since it can cause renal failure. This medication should be questioned by the nurse. 3. The client with DM should receive their prescribed insulin as soon as they are no longer NPO. 4. The client with Addison's would be receiving prednisone, therefore, the nurse would not question administering this medication. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, synthesis making nursing decisions, the nurse must be aware of INTE preventions that must be implemented prior to administering medications. The nurse must know what to monitor prior to administering medications because untoward reactions and possibly death can occur. 55.1. The client with a unilateral adrenalectomy should be ambulated to prevent postoperative complications. This task could be delegated to the UAP. 2. The UAP can change linens for a client. Acute thyrotoxicosis is not a life-threatening condition. 3. The client with D is very thirsty and craves ice water, therefore, this task can be delegated to the UAP. 4. The client just returning from surgery and the PACU should be assessed immediately by the nurse. The UAP is not qualified to identify an unstable situation. Answers 234. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, management, client needs, safe and effective care environment, management of care, supervision. Cognitive level, analysis making nursing decisions, the nurse must ensure the UAP can perform any tasks that are delegated. It is the nurse's responsibility to demonstrate and/or teach the UAP how to perform the task, and evaluate the task. 56.1. The manager should assess the abilities of each staff member for the needs of the unit before deciding which staff member to transfer. 2. This may be the method used by many managers, but the best action is to evaluate the needs of the unit and the abilities of the staff. 3. In many instances, the unit manager must make hard decisions without consulting the staff members. Asking for the staff members' input could cause tension among the staff, therefore, this is not an appropriate intervention. 4. This will be completed after the decision has been made and the staff member notified. Content, medical/surgical, category of health alteration, management, integrated processes, nursing process, evaluation, client needs, safe and effective care environment, management of care, supervision, cognitive level, comprehension making nursing decisions, there will be management questions on the NCLEX-RN registered. Concepts of management is included under the category safe and effective care environment and subcategory management of care. 57.1. Children are being diagnosed with type 2 diabetes mellitus because of excessive intake of calories and lack of exercise. This is the priority problem. Many states are performing screening activities to identify children at risk for developing type 2 DM so that interventions can be made to delay or prevent the child being diagnosed with type 2 DM. Acanthosis nigricans, hyperinsulinemia, can be identified with simple, non-invasive screening. 2. The client has a risk of low self-esteem because of the excess weight, but if the client and parents adhere to the recommended treatment regimen for weight control, diet, and exercise, the client's self-esteem should improve. 3. The client's problem is hyperglycemia, not hypoglycemia. 4. Amputation is a chronic problem associated with diabetes and occurs after years of uncontrolled blood glucose levels. This is not the priority problem at this time. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, evaluation, client needs, health promotion and maintenance, health promotion/disease prevention, cognitive level, synthesis making nursing decisions. The NCLEX-RN registered integrates the new nursing process throughout the client needs categories and subcategories. The nursing process is a scientific, clinical reasoning approach to client care that includes assessment, analysis, planning, implementation, and evaluation. The nurse will be responsible for identifying nursing diagnoses for clients. 58.1. On a floor not directly affected by the fire, the oxygen is turned off only at the instruction of the administrative supervisor or plant operations director. 2. The clients are safer on the floor where they are, not in an area closer to the fire. 3. The first action in a code red, actual fire, is to rescue, the clients in immediate danger, followed by confine, closing the doors. Doors in a hospital must be fire rated to confine a blaze for an hour and a half. 4. This could be done, but it is a charge nurse's responsibility that is not called for at this time. Content, medical/surgical, category of health alteration, management, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, supervision, cognitive level, synthesis making nursing decisions. The nurse must be knowledgeable of emergency preparedness. Employees receive this information in employee orientation and are responsible for implementing procedures correctly. The NCLEX-RN registered blueprint includes questions on promoting a safe and effective care environment. 59.1. The nurse should check the laboratory tests to determine the thyroid levels, but this is not the first intervention. 2. Assessing the client for diarrhea could be done, but it is more important not to worsen the problem, and, therefore, the nurse should hold the thyroid medication first. 3. Documentation of client complaints is always important, but it is not the first intervention. 4. The client is describing symptoms of hyperthyroidism. Because the client is Chapter 8 Endocrine Management 235 diagnosed with hypothyroidism, has been prescribed thyroid hormone replacement, and now has symptoms of hyperthyroidism, it can be assumed that the client now has an excess of thyroid hormone. Therefore, the nurse should hold the thyroid medication and check the client's thyroid profile. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, evaluation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, synthesis. Making nursing decisions, the nurse must be aware of expected actions of medications. The nurse must be aware of assessment data indicating whether the medication is effective or whether the medication is causing a side effect or an adverse effect. 61. PTU blocks peripheral conversion of T4 to T3 and is prescribed for the client diagnosed with hyperthyroidism. The nurse would not question administering this medication. 2. DAP is the treatment of choice for the client diagnosed with central diabetes insipidus. 3. Genotropin, a growth hormone, is the treatment of choice for clients with hypofunction of the pituitary gland. 4. The client with hypothyroidism has a decreased pulse rate, therefore, the nurse should not administer a beta blocker, which could further decrease pulse rate. The client with thyrotoxicosis, hyperthyroidism, would receive Inderal. The nurse should question administering this medication. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis. Making nursing decisions, the nurse must be aware of medicatio NS prescribed for specific conditions and disease processes. The nurse is the last person who ensures the client receives the correct medications. 61.1. A terminally ill client should be allowed comfort measures even when the activity would normally not be encouraged or allowed. The client can receive sliding scale insulin, if needed, to cover the ice cream. 2. The nurse could do this after the ice cream has been metabolized to determine whether an insulin injection is needed. 3. The nurse should tell the client that foods such as ice cream may be consumed in moderation and with the appropriate coverage. 4. Low-fat sweets may be a good substitute for some of the foods the client may want to eat. Content: end of life, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, synthesis. Making nursing decisions, the NCLEX-RN registered addresses questions concerned with end-of-life care. This is included in the psychosocial integrity section of the test blueprint. Supporting the client's choice is an appropriate option when working with clients who are dying. 62.1. The hob should be elevated 30 degrees because the elevation avoids pressure on the sella turcica and decreases headaches, a frequent postoperative problem. 2. A hypophysectomy is surgery that removes the pituitary gland by making an incision in the inner aspect of the upper lip and gingival. The client should avoid vigorous coughing, sneezing, and straining at stool. 3. A hypophysectomy is surgery that removes the pituitary gland by making an incision in the inner aspect of the upper lip and gingival. The sella turcica is entered through the floor of the nose and sphenoid sinuses. There are no visual incisions and the nose cannot be splinted. 4. The UAP can take the client's vital signs. This would not warrant intervention by the nurse. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, evaluation, client needs, safe and effective care environment, management of care, supervision, cognitive level, analysis making nursing decisions. The nurse must ensure the UAP can perform any tasks that are delegated. It is the nurse's responsibility to demonstrate and/or teach the UAP how to perform the task, and evaluate the task performed. 63.1. The client needs preoperative teaching, and the charge nurse should not request a discharge for a client having surgery in the morning. 2. This client is stable and could be prescribed oral pain medication. She could be discharged home and followed by home health nursing if needed. This client is the most appropriate client for the charge nurse to request to be discharged. Answers 236. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 3. This client is experiencing a complication of surgery and is hemorrhaging. The hemoglobin/HCT is very low. Therefore, this client cannot be discharged home. 4. This client may be showing signs of acute rejection. Therefore, this client cannot be discharged home. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, delegation, cognitive level, analysis making nursing decisions. When the nurse is deciding WHI/CH client should be discharged home, the most stable client should be discharged. 64.1. This is a normal potassium level, and the HCP does not need to be notified. 2. This level is within therapeutic range, and the HCP does not need to be notified. 3. A BUN of 84 mg/dl is an abnormal lab value, but it would be expected in a client diagnosed with ESRD. The HCP does not need to be notified. 4. This is a very high blood glucose level, and the client diagnosed with type 1 diabetes will be catabolizing fats at this level and is at risk for diabetic ketoacidosis, DKA, coma. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, evaluation, client needs, physiological integrity, reduction of risk potential, laboratory values, cognitive level, analysis making nursing decisions. The nurse must be knowledgeable of normal laboratory values. These values must be memorized, and the nurse must be able to determine if the laboratory value is normal for the client's disease process or medications the client is taking. 65.1. The client with DKA would have fruity breath. Therefore, this nursing intervention does not have priority. 2. Glucose levels are monitored at least every hour. 3. The pulse oximeter reading is not priority for a client in DKA. 4. The client will be on a regular insulin drip, which must be maintained at the prescribed rate on an intravenous pump device. Decreasing the client's blood glucose level is the priority nursing intervention. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, physiological integrity, physiological adaptation, illness management, cognitive level, analysis making nursing decisions. The nurse should remember if a client is in distress and the nurse can do something to relieve the distress, it should be done first, before assessment. The test taker should select an option that directly helps the client's condition. 66.1. The client's hemoglobin A1C is a test that reveals the average blood glucose for the previous 2 to 3 months. The current blood glucose level may or may not be in the desired range, but the client's diabetes with this level of hemoglobin A1C is not controlled. 2. The nurse should assess for complications of diabetes, but this is not the first intervention. Getting the client to realize the meaning of a high hemoglobin A1C is the priority at this time. 3. The client must be taught the long-term effects of hyperglycemia. A hemoglobin A1C of 11 indicates an average blood glucose of 310 mg/dl. Over time, a level higher than 120 to 140 mg/dl can lead to damage to many body systems. 4. Monitoring blood work is not priority over teaching the client about complications of diabetes when having such a high A1C. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis making nursing decisions. The nurse must be knowledgeable of normal laboratory values. These values must be memorized and the nurse must be able to determine if the laboratory value is normal for the client's disease process or medications the client is taking. 67.1. This client has an elevated WBC count, which could indicate an infection. The HCP should be made aware of this client first. 2. These are normal lab values. 3. These are normal lab values. 4. These are normal lab values. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, evaluation, client needs, physiological integrity, reduction of risk potential, laboratory values, cognitive level, analysis making nursing decisions. This is an alternate type of Q. Question included in the NCLEX-RN registered blueprint. The test taker must be able to read a Chapter 8 Endocrine Management 237 chart, be knowledgeable of laboratory data, and make decisions concerning the nurse's most appropriate action. 68. The nurse should administer 8 units of regular insulin, since 249 is between 201 and 250. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, comprehension making nursing decisions. A fill-in-the-blank question. N is an alternate type of question included in the NCLEX-RN registered. The test taker must use the number keyboard to answer fill-in-the-blank questions. 69. 1, 2, and 3 are correct. 1. The UAP can escort the patient to the examination room and take the initial vital signs. 2. The UAP can weigh the patient and document the weight. 3. The UAP can clean the room and prepare it for the next patient. 4. Discussing prescriptions is teaching and the nurse cannot delegate teaching. 5. Calling the pharmacy requires knowledge of medications and medication administration. This task cannot be delegated to a UAP. Content, medical/surgical, category of health alteration, management, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, supervision, cognitive level, analysis making nursing decisions. This is an alternate type of question included in the NCLEX-RN registered. The nurse must be able to select all the options that answer the question correctly. There are no partially correct answers. The nurse cannot delegate assessment, teaching, evaluation, medications, or an unstable client to the UAP. 70. Correct answer, 1, 3, 4, 2, 5, 1. This client may have overdosed accidentally or on purpose. This is a physiological problem and the nurse must determine which intervention is required next. This is a potentially life-threatening situation, so the nurse should return this phone call first. 3. The client with hypothyroidism is reporting signs of hyperthyroidism, indicating the client is overdosing on the thyroid hormone replacement and needs to be seen in the clinic. This is a physiological problem, therefore, the nurse should call this client second. 4. The pharmacist needs to know if the substitution can be made in order to fill this prescription. This call should be returned third. 2. The nurse needs to discuss the prescribed medication with the HCP to see if a different, less expensive medication would work as well for the client, or if there is an alternative medication program that could be discussed with the client. This phone call should be returned fourth. 5. The nurse must first determine where the breakdown in the communication of the results of the MRI occurred, then obtain the results and provide them to the HCP prior to returning the call. This phone call can be returned last. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, synthesis making nursing decisions. This is an alternate type of question, and that requires the nurse to assess clients in order of priority. This requires the nurse to evaluate each client's situation and determine which situations are life-threatening, which situations are expected for the client's situation, and which client has a psychosocial problem. Answers 238. Prioritization, delegation, and management of care for the NCLEX-RN registered exam clinical scenario. Answers and rationales. The correct answer number and rationale for why it is the correct answer are given in boldface type. Rationales for why the other possible answer options are incorrect also are given, but they are not in boldface type. 1, 2, 3, 6, 9, and 10 are correct. 1. This is an assessment question and is needed to determine the extent of the current situation. 2. Knowing the blood glucose level is important for the nurse to determine if the client is at risk for diabetes ketoacidosis, DKA. 3. This will determine what has been tried and what the next step will be. 4. The client should drink liquids that will provide calories, since for glucose control Mr. Larry will still need to take his insulin and he could experience a hypoglycemic reaction if he does not have some form of caloric intake. 5. Without insulin Mr. Larry's body will begin to break down fats. A byproduct of fat catabolism is acid. The buildup of acid in the body will result in diabetic ketoacidosis, DKA, which can lead to coma and death. 6. Mr. Larry should monitor his urine ketones. The body usually does not spill ketones in the urine until after the blood glucose levels reach 240 and above. Urine ketones indicate the client's, Mr. Larry's, body will begin to break down fats, and ketones are the byproduct of fat metabolism. 7. At this time Mr. Larry should try to practice sick day rules for clients diagnosed with diabetes mellitus. It is the responsibility of Mr. John to teach the client how to manage the disease process during times of illness. 8. The emergency medical system should not be called until it is determined that Mr. Larry cannot manage the virus symptoms without further medical intervention. 9. If Mr. Larry is spilling ketones in his urine, then the healthcare provider will need to adjust his insulin dosage. 10. In order to prevent DKA, Mr. Larry must continue to take his insulin. To prevent hypoglycemia he should attempt to ingest calories to balance the insulin. The antidote for insulin is food. 2.1. Ms. Leslie should assess the client for dehydration and electrolyte imbalance. 2. Ms. Leslie should perform bedside glucose checks at least every hour. 3. Initiate an intravenous drip of NS and regular insulin. 4. Perform oral care. 5. Monitor electrolyte levels, potassium and sodium levels. 3.1. Review sick day rules with Mr. Larry and have Mr. Larry verbalize the information back to the nurse, Mr. Justin. 2. Let Mr. Larry know when the HCP wants to see him in the office. 3. Refer Mr. Larry to a clinical diabetes educator. 4. Review diabetes care with Mr. Larry to include self-monitoring, foot care, and eye care. 239. Integumentary management. 9. If something comes in life in others because of you, then you have made an approach to immortality. Norman Cousins. 1. The nurse received the AM shift report on the following clients. Which client should the nurse assess first? 1. The client with the right total knee replacement who wants to be removed from the continuous passive motion, CPM, machine. 2. The client diagnosed with chronic low back pain who is crying and upset about being discharged home. 3. The client who is 1 week postoperative for right total hip replacement, THR, who has a temperature of 100.4 degrees Fahrenheit. 4. The client who has full thickness burns who needs to be medicated before being taken to Whirlpool. 2. The nurse is working in an orthopedic unit. Which client should the nurse assess first? 1. The client who is 2 weeks postoperative open reduction and external fixation, ORIF, of the right hip who is complaining of pain when ambulating. 2. The client who is 10 days postoperative for left total knee replacement, TKR, who is refusing to use the continuous passive motion, CPM, machine. 3. The client who is 1 week postoperative for L3, L4 laminectomy who is complaining of numbness and tingling of the feet. 4. The client who is being admitted to the rehabilitation unit from the orthopedic surgical unit after a motor vehicle accident, MVA. 3. The client is 1 week postoperative for right below the knee amputation secondary to arterial occlusive disease. The nurse is unable to assess a pedal pulse in the left foot. Which intervention should the nurse implement first? 1. Assess for paresthesia and paralysis. 2. Utilize the Doppler device to auscultate the pulse. 3. Place the client's leg in the dependent position. 4. Wrap the client's left leg in a warm blanket. Questions 4. The male client who has a history of cerebrovascular accident, CVA, is admitted to the orthopedic unit with a fractured right hip. The client is complaining of bleeding when brushing his teeth. The nurse reviews the client's medication administration record, MAR. Which intervention should the nurse implement first? 240 Prioritization, delegation, and management of care for the NCLEX-RN registered exam client's name, account number, 123,456 allergies, NKDA height, 72 inches weight, 240 pounds date signature / initials medication levothyroxine, Synthroid, 1 tablet POQD atenolol, Tenormin, 50 mg POQD warfarin, Q. Madden, 5 mg Po 1700 hydrocodone 5 mg / 500 mg Po Q 4 to 6 hours PRN for pain 0701 to 1900 0900 DN 0900 DNAP 72 1700 DN Day Nurse RN / DN 1901 to 06591. Prepare to administer aquamaphaton, vitamin K. 2. Determine whether the client is using a soft bristle toothbrush. 3. Check the client's apical pulse and blood pressure. 4. Request the laboratory to draw a stat-INR. 5. The nurse is preparing to administer morning, AM, medications to the following clients. Which medication should the nurse administer first? 1. The NSAID to the client diagnosed with osteoarthritis. 2. The intravenous antibiotic to the client with cellulitis. 3. The antiviral agent to the client with herpes zoster, shingles. 4. The antihistamine to the client with urticaria and pruritus. 6. The client tells the nurse, I have a mole on my back which is darker and getting larger. Which intervention should the nurse implement first? 1. Tell the client to use corticosteroid cream on the area. 2. Recommend the client use SPF 15 when in the sun. 3. Instruct the client to notify his or her healthcare provider immediately. 4. Encourage the client to wear dark, woven clothing when outside. 7. The nurse is at a local playground and her 10-year-old son falls and complains of his left ankle and foot hurting. Which intervention should the nurse implement first at the scene of the accident? 1. Instruct her son not to move the left leg. 2. Elevate the left leg on 2 rolled towels. 3. Apply an ice pack to the left ankle. 4. Check her son's pedal pulse bilaterally. 8. The nurse is preparing to change a dressing on an 82-year-old client with a stage 3 pressure ulcer. Which intervention should the nurse implement first? 1. Obtain the needed equipment to perform the procedure. 2. Remove the client's old dressing with non-sterile gloves. 3. Explain the procedure to the client in understandable terms. 4. Check to determine whether the client has received pain medication. 9. Which client should the charge nurse on the rehabilitation unit assess first after receiving the AM shift report? 1. The client diagnosed with an open reduction and external fixation, ORIF, of the right hip who has a hemoglobin and hematocrit, HNH, of 8/24. 2. The client diagnosed with rheumatoid arthritis who has a positive rheumatoid factor, RF. 3. The client diagnosed with a stage 4 pressure ulcer who has a white blood cell, WBC, count of 14,000. 4. The client diagnosed with systemic allergies on prednisone dose pack who has a glucose level of 189 mg/dl. 10. The client ambulating down the orthopedic hallway unassisted fell to the floor. Which action should the nurse implement first? 1. Complete an adverse occurrence report. 2. Notify the clinical manager on the unit. 3. Determine whether the client has any injuries. 4. Ask why the client was in the hall alone. 11. The nurse and the unlicensed assistive personnel, UAP, are caring for clients on a rehabilitation unit. Which nursing task is most appropriate for the nurse to delegate to the UAP? 1. Flush the triple lumen lines on a central venous catheter. 2. Demonstrate for the client how to ambulate with a walker. 3. Assist with bowel training by escorting the client to the bathroom. 4. Apply corticosteroid cream to the client with allergic dermatitis. 12. The unlicensed assistive personnel, UAP, tells the nurse the client with the right above the knee amputation has a large amount of bright red blood on the right leg residual limb. Which action should the nurse implement? 1. Assess the client's residual limb dressing. 2. Tell the UAP to take the client's pulse and blood pressure. 3. Remove the dressing to assess the incision. 4. Request the UAP to reinforce the dressing. 13. Which action by the unlicensed assistive personnel, UAP, warrants immediate intervention by the nurse? 1. The UAP tied the confused client to a chair with a sheet. 2. The UAP escorted the client downstairs to smoke a cigarette. 3. The UAP bought the client a carbonated beverage from the cafeteria. 4. The UAP assisted the client to ambulate to the dayroom area. 14. The charge nurse, a licensed practical nurse, LPN, and 2 unlicensed assistive personnel, UAPs, are caring for clients. Which action is most appropriate for the charge nurse to assign/delegate? 1. Ask the UAP to apply warm compresses to the client with tinea corporis. 2. Request the LPN to apply antifungal cream to the client with tinea pedis. 3. Tell the UAP to remove the toenail of the client with onychomycosis. 4. Instruct the LPN to administer Accutane to the client who is pregnant. 15. The nurse in the rehabilitation unit is caring for clients along with an unlicensed assistive personnel, UAP. Which action by the UAP warrants immediate intervention? 1. The UAP assists a client 1 week postoperatively to eat a regular diet. 2. The UAP calls for assistance when taking a client to the shower. 3. The UAP is assisting the client who weighs 181 kilograms to the bedside commode. 4. The UAP places the call light within reach of the client who is sitting in the chair. Chapter 9 Integumentary Management 241 Question 16. The unlicensed assistive personnel, UAP, on the rehabilitation unit is placing the client with a left above the knee amputation in the prone position. Which action should the nurse implement? 1. Tell the UAP to place the client on the back. 2. Praise the UAP for positioning the client prone. 3. Report this action verbally to the charge nurse. 4. Explain to the UAP that the client should not be placed on the stomach. 17. The unlicensed assistive personnel, UAP, is applying elastic compression stockings to the client. Which action by the UAP indicates to the nurse the UAP understands the correct procedure for applying the elastic compression stockings? 1. The UAP applies the stockings while the client is sitting in a chair. 2. The UAP is unable to insert 2 fingers under the proximal end of the stocking. 3. The UAP had the client elevate the legs prior to putting on the stockings. 4. The UAP places the toe opening of the elastic stocking on top of the client's foot. 18. The charge nurse on the acute care rehabilitation unit is making assignments for the shift. Which client should the charge nurse assign to the most experienced nurse? 1. The client with a full thickness burn who is refusing to go to therapy. 2. The client with osteomyelitis who has bone pain and a fever. 3. The client with fractured tibia who has deep, unrelenting pain. 4. The client with low back pain radiating down the left leg. 19. The charge nurse on the busy 36-bed rehabilitation unit must send one staff member to the emergency department, ed. Which staff member is the most appropriate person to send? 1. The LPN who has worked on the rehabilitation unit for 3 years. 2. The RN who has been employed on the rehabilitation unit for 8 years. 3. The UAP who is completing the 4-week orientation to the rehabilitation unit. 4. The RN who transferred to the rehabilitation unit from the medical unit. 20. Which task should the rehabilitation nurse delegate to the unlicensed assistive personnel, UAP? 1. Tell the UAP to show the client how to perform self-catheterization. 2. Ask the UAP to place the newly confused client in the inclusion bed. 3. Request the UAP give the client 30 ml of Maalox, an antacid. 4. Encourage the UAP to attend the multidisciplinary team meeting. 21. The client is 8 hours postoperative spinal surgery. Which priority intervention should the nurse implement? 1. Evaluate how much pain medication the client is using via the patient-controlled analgesia, PCA, pump. 2. Log roll the client with 3 staff members when turning the client side to side. 3. Assist the client to ambulate to the bathroom using an elevated commode seat. 4. Place pillows under the thighs of each leg when the client is in supine position. 22. The elderly wife of a client with a total hip replacement who is being discharged home tells the nurse, "I am really worried about taking my husband home. I don't know how I will be able to take care of him." Which intervention is most appropriate for the nurse? 1. Refer the client to the home health nurse. 2. Discuss the possibility of placing her husband in a nursing home. 3. Request the client's healthcare provider to talk to the wife. 4. Allow the client's wife to ventilate her feelings about the situation. 23. The male nurse who has been told by the female nurse on previous occasions not to talk to her about her body says, "You really look hot in that scrub suit. You have a great looking body." Which action should the female nurse take next? 1. Document the comment in writing and file a formal grievance. 2. Tell the male nurse this makes her feel very uncomfortable. 3. Notify the clinical manager of the sexual harassment. 4. Discuss the male nurse's behavior with the hospital lawyer. 242. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 24. The client who was admitted to the rehabilitation unit because of a debilitative state asks the nurse, "Why do I have to go to physical therapy every day?" Which statement is the nurse's best response? 1. The physical therapy will help you become more independent in caring for yourself. 2. You must have at least 3 hours of therapy a day to be able to stay in this rehab unit. 3. The multidisciplinary team determined that you should be in physical therapy daily. 4. The physical therapist will help you with exercises to improve your muscle strength. 25. The client diagnosed with a fractured right ankle needs to be instructed on crutch walking. Which member of the multidisciplinary team should address this problem? 1. The physical therapist. 2. The social worker. 3. The occupational therapist. 4. The rehabilitation physician. 26. The client with bilateral amputations tells the nurse, "I was told I can't go back to my job because they do not have handicap-accessible bathrooms or ramps." Which action by the nurse is most helpful to the client? 1. Discuss the situation with the multidisciplinary healthcare team. 2. Explain the Americans with Disabilities Act, ADA, to the client. 3. Contact the client's employer via telephone and discuss the situation. 4. Encourage the client to hire an attorney and sue the employer. 27. Which action by the female primary nurse would warrant immediate intervention by the charge nurse on the rehabilitation unit? 1. The primary nurse tells the unlicensed assistive personnel, UAP, To escort a client to the swimming pool. 2. The primary nurse evaluates the client's plan of care with the family member. 3. The primary nurse asks another nurse to administer an injection she prepared. 4. The primary nurse requests another nurse to watch her clients for 30 minutes. 28. The client in a motor vehicle accident, MVA, is in critical condition with a pelvic fracture, flail chest, bilateral arm fractures, and a left hip fracture. The client tells the nurse, "I just want to die. I can't feed myself or clean myself." Which statement is the nurse's best response? 1. I know this must be hard for you, but you can have a life. 2. I can see you must feel helpless, I am here to listen. 3. Have you thought about killing yourself? 4. You are in shock, but in time things will get better. 29. The nurse on the surgical unit is being sent to the neonatal intensive care unit, NICU, to work because the unit is short-staffed. The nurse has never worked in the NICU. Which response by the nurse supports the ethical principle of non-malfeasance? 1. The nurse requests not to be floated to the NICU. 2. The nurse accepts the assignment to the NICU. 3. The nurse asks why another nurse can't go to the NICU. 4. The nurse talks another nurse into going to the NICU. 30. The client's husband is frustrated and tells the nurse, "Everyone is telling me something different as to when my wife is going to be able to go home. I don't know whom to believe." Which statement is the rehabilitation nurse's best response? 1. I can see you are frustrated. Would you like to talk about how you feel? 2. I will contact the case manager and have her talk to you as soon as possible. 3. Do not worry. Your wife won't go home until you and she are both ready. 4. Your wife's healthcare provider should be able to give you that information. Chapter 9 Integumentary Management 243 Questions 31. The client with an upper extremity amputation tells the nurse, "I do everything with my right hand and now it is gone. I have no idea what I am going to do after I get discharged. How will I support my family? I will need to get a new job." Which statement is the nurse's best response? 1. With time you will be able to use your left hand now. 2. The State Rehabilitation Commission will help retrain you. 3. You should ask the social worker about applying for disability. 4. You are worried about how you will be able to support your family. 32. The client tells the nurse, "I do not like my doctor and I want another doctor." Which statement is the nurse's best response? 1. You should tell your doctor you are not happy with his care. 2. Can you tell me what you don't like about your doctor's care? 3. I will notify my nursing supervisor and report your concern. 4. I am sorry, but you really must keep this doctor until you are discharged. 33. The nurse and the unlicensed assistive personnel, UAP, are caring for a 74-year-old client who is 3 days postoperative right total hip replacement, THR. Which nursing task should be delegated to the UAP? 1. Place the abductor pillow between the client's legs. 2. Ensure the client stays on complete bed rest. 3. Feed the client the evening meal. 4. Check the client's right hip surgical dressing. 34. The nurse tells the unlicensed assistive personnel, UAP, to assist the client who is 1 day postoperative spinal surgery with AM care. Which action by the UAP warrants immediate intervention? 1. The UAP closes the door and cubicle curtain. 2. The UAP requests the client to turn to the side. 3. The UAP checks the temperature of the bathing water. 4. The UAP puts the side rails up when bathing the client. 35. The client with the right below the knee amputation who also has impetigo is admitted to a rehabilitation unit. Which interventions should be included in the nursing care plan? Select all that apply. 1. Elevate the client's right leg on 2 pillows. 2. Refer the client to occupational therapy daily. 3. Encourage the client to push the residual limb against a pillow. 4. Use warm soap and water to remove the crusts secondary to impetigo. 5. Ensure all staff members wear gloves when caring for client. 36. The overhead page has issued a code black, indicating a tornado in the area. Which intervention should the charge nurse implement? 1. Instruct the hospital staff to assist the clients and visitors to the cafeteria. 2. Request the client and visitors go into the bathroom in the client's room. 3. Have the clients and visitors remain in the hallway with the doors closed. 4. Tell the client and any visitors to remain in the client's room with the door open. 37. The male client is placed in a double hip spica cast for 3 months. The client's wife tells the nurse, "My husband said we are supposed to talk to his case manager." What is a case manager? Which statement is the nurse's best response? 1. A case manager discusses the cost and insurance issues concerning the rehabilitation. 2. The case manager is responsible for the medical treatment regimen for your husband. 3. The case manager is a member of the team who will assist your husband in finding another job. 4. The case manager is a nurse who will coordinate the rehabilitation team and keep you informed. 244. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 38. The 28-year-old male client who sustained traumatic bilateral amputation secondary to a motor vehicle accident, MVA, is being discharged home to live with his wife and 3-year-old son. Which priority psychosocial intervention should the rehabilitation nurse discuss with the client? 1. Ask the client whether he has any sexual concerns he needs to discuss. 2. Determine whether the home is safe for ambulating with prosthetic devices. 3. Discuss the procedure for obtaining a specially equipped car. 4. Explain the importance of getting psychological counseling. 39. The primary nurse overhears the unlicensed assistive personnel, UAP, telling a family member of a client, "One of the clients will be going to prison because that person was charged with vehicular manslaughter. 2 people in the motor vehicle accident died." Which action should the primary nurse implement first? 1. Apologize to the family member for the UAP's comments. 2. Tell the UAP that the comment is a violation of HIPAA. 3. Allow the UAP to complete the conversation and then discuss the situation. 4. Interrupt the conversation and tell the UAP to go to the nurse's station. 40. The clinical manager has verbally warned a female staff nurse about being late to work on 2 previous occasions. The nurse was 35 minutes late for today's shift. Which action should the charge nurse take? 1. Ask the staff nurse why she was late again today. 2. Notify the Human Resources Department in writing. 3. Initiate the hospital policy for unacceptable behavior. 4. Do not allow the staff nurse to work on the unit today. 41. The charge nurse on the rehabilitation unit is making assignments for the day shift. Which assignment would be most appropriate for the licensed practical nurse, LPN? 1. Have the LPN call the HCP to obtain an order for a diet change. 2. Instruct the LPN to complete the admission assessment. 3. Ask the LPN to teach the client about a high-fiber diet. 4. Request the LPN to obtain the intake and output for the clients. 42. The charge nurse received laboratory data on the following clients. Which client warrants immediate intervention by the charge nurse? 1. The client with COPD who has ABGs of pH 7.35, PAO2, 77, PACO2, 57, HCO3, 24. 2. The client diagnosed with bilateral TKR who has a WBC count of 10,400. 3. The client on antibiotic therapy who has a serum potassium level of 3.3 milliequivalent/L. 4. The client receiving TPN who has a glucose level of 145 mg/dl. 43. The client tells the primary nurse, "I just finished completing my living will and I need you to witness my signature." Which action should the nurse implement? 1. Witness the client's living will using an ink pen. 2. Explain that the nurse cannot witness this document. 3. Tell the client the document does not need a witness's signature. 4. Offer to have the hospital attorney to come notarize the form. 44. The nurse is preparing to ambulate the client with full-thickness burns on the lower extremities down the hall. Which priority intervention should the nurse implement? 1. Place rubber-soled shoes on the client. 2. Put a gait belt around the client's waist. 3. Explain the procedure to the client. 4. Provide a clear path for the client to walk. 45. The client in the rehabilitation unit tells the nurse, "I will not go to physical therapy again because it hurts so much when I do the exercises." Which statement supports the nurse's role as a client advocate? 1. You do not have to go to physical therapy if it causes you pain. 2. I will talk to the physical therapist, PT, about the exercises that cause you pain. 3. Let me check and see if you can receive pain medication before therapy. 4. I will discuss your concerns at the next multidisciplinary team meeting. Chapter 9 Integumentary Management 245 Questions 46. The rehabilitation nurse enters the client's room and the client is talking on the phone. The client asks the nurse to talk to his wife because she has some questions. Which action should the nurse take? 1. Explain that HIPAA regulations prevent the nurse from talking to the wife. 2. Tell the client it would be best for the nurse to talk to the wife in person. 3. Request the client's wife to come to the weekly team meeting to ask questions. 4. Honor the client's request and answer any questions the wife has on the phone. 47. The school nurse notes the child has impetigo. Which interventions should the nurse implement? Select all that apply. 1. Administer an antibiotic ointment 4 times a day. 2. Instruct the parents to keep the child at home until lesions crust over. 3. Tell the parents to use separate towels for the child. 4. Do not remove the crusts from the skin lesions. 5. Tell the parents to have the child wear non-latex sterile gloves over both hands until no crusting is present. 48. Which action by the primary nurse requires immediate intervention by the charge nurse? 1. The nurse is teaching the client how to use a glucometer. 2. The nurse leaves the computer screen open at the nurse's station. 3. The nurse is discussing a client's situation on the phone with the HCP. 4. The nurse contacts the chaplain to come and talk to a client. 49. The nurse is triaging phone calls in a dermatological clinic. Which client warrants the nurse making an appointment immediately? 1. The client reports having white spots on both of the hands. 2. The client reports redness and itching on the hands. 3. The client reports a cherry angioma on the right lower leg. 4. The client reports red patches on one side of the body. 50. The client has an area on the skin the dermatologist thinks may be basal cell carcinoma. Which intervention will the nurse implement to confirm the diagnosis? 1. Refer the client for the magnetic resonance imaging, MRI. 2. Explain how to obtain a washing of the abnormal skin area. 3. Prepare the client for a biopsy of the abnormal skin growth. 4. Tell the client there is no way to definitively confirm the diagnosis. 51. The nurse is assisting the client to use a cane when ambulating. Rank in order of performance the interventions the nurse would take. 1. Request the client to move the cane forward. 2. Move the weaker leg 1 step forward. 3. Ensure the client places the cane in the strong hand. 4. Move the stronger leg 1 step forward. 5. Apply a gates belt around the client's waist. 52. Which priority intervention should the nurse implement to help prevent pressure ulcers in the client who is on strict bed rest? 1. Provide adequate skin care for the client. 2. Turn the client every 2 hours or more often. 3. Ensure sufficient nutritional intake. 4. Use pressure relieving devices such as water beds. 53. Which intervention should the nurse implement first for the client with a fractured femur who is suspected of having a fat embolism? 1. Assess the client's bilateral breath sounds. 2. Encourage the client to cough and deep breathe. 3. Administer oxygen via nasal cannula. 4. Prepare to administer intravenous heparin therapy. 246. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 54. The client with an electrical burn is brought to the emergency department, ed. The entrance wound is on the right hand and the exit wound is on the left foot. Which intervention should the nurse implement first? 1. Place sterile gauze on the entrance and exit wounds. 2. Assess the client's vital signs. 3. Monitor the client's pulse oximetry. 4. Place the client on cardiac telemetry. 55. The nurse is using an electric patient Hoyer lift to transfer the client from the bed to a stretcher. Which priority intervention should the nurse implement? 1. Have 2 staff members assist when using the lift. 2. Ensure the client is correctly placed in the lift prior to moving. 3. Lift the client slowly off the bed when turning on the lift. 4. Ensure the stretcher is in the correct position and locked. 56. The nurse is assessing the functional ability of a client using the CATS Index of Activities of Daily Living, ADLS. Which assessment grade would require the nurse to delegate feeding, bathing, and toileting to the unlicensed assistive personnel, UAP? 1. CATS Index of ADLS Grade A. 2. CATS Index of ADLS Grade C. 3. CATS Index of ADLS Grade E. 4. CATS Index of ADLS Grade G. 57. The client has cellulitis on the right lower leg. Which intervention should the nurse implement? 1. Place the client's right arm in the dependent position. 2. Apply warm moist heat to the affected area. 3. Wash the affected area with anti-staphylococcal soap. 4. Wrap the right arm with ACE bandages. 58. The unlicensed assistive personnel, UAP, is transferring the client from the bed to the chair. Which interventions should the nurse ensure the UAP implements during this procedure? Rank in order of priority. 1. Assist the client to sit when the client's legs touch the edge of the chair. 2. Place the wheelchair at an angle on the client's strong side. 3. Assist the client to stand and put strong hand on the wheelchair armrest. 4. Keep the client's weight forward and pivot the client. 5. Lock the wheelchair brakes and secure the chair position. 59. The charge nurse on the rehabilitation unit is assigning/delegating tasks to the unlicensed assistive personnel, UAP, and licensed practical nurse, LPN. Which task is most appropriate for the nurse to delegate/assign? 1. Tell the UAP to elevate client's residual limb above the heart. 2. Instruct the LPN to give the diabetic clients their HS snacks. 3. Request the UAP to insert an indwelling urinary catheter. 4. Ask the LPN to assess the client who may have herpes zoster. 60. The nurse is caring for a client diagnosed with a full-thickness burn over the right lower extremity. Which task should the nurse delegate to the UAP? 1. Instruct the UAP to check the client's right dorsalis pedal pulse. 2. Ask the UAP to cleanse the client's dentures and place in the container. 3. Request the UAP to perform passive range of motion, ROM, exercises. 4. Tell the UAP to keep the client's right leg in the dependent position. 61. The client is admitted to the emergency department, ed., with a third-degree burn over the front of both legs. Which priority intervention should the nurse implement? 1. Maintain sterile environment when caring for the client. 2. Insert 2 large-bore intravenous access routes. 3. Administer intravenous antibiotic therapy. 4. Assess the client's pain level on a 1 to 10 pain scale. Chapter 9 Integumentary Management 247 Question 62. The day nurse is preparing to administer medications to the client who is complaining of lightheadedness when getting out of bed. Which medication should the day nurse question administering? 248 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Client's Name, Smith Account Number, 132,456 Height, 72 inches Weight, 75 kilograms Date Signature/Initials Day Nurse RN/DN Medication Atenolol, Tenormin, 50 mg POQD Ceftriaxone, Rosfin, 150 mg IV BPQ 12 hours Bisacod. YL, Ducalax, 2-PO-PRN constipation hydrocodone 5 mg/500 mg PO-Q 4 to 6 hours PRN for pain 0700 to 1900 0900 0900 1900 to 07001. Atenolol, Tenormin, 50 mg. 2-Ceftriaxone, Rosfin, 150 mg IV/PB. 3-Bisacodyl, Ducalax, 2-PO. 4. Administer all medications as ordered. 63. The nurse is discussing alternative medication, CAM, with the client on the rehabilitation unit. Which therapies should the nurse discuss with the client? Select all that apply. 1. Acupuncture. 2. Guided imagery. 3. Compression sequential devices. 4. Music therapy. 5. Muscle strengthening exercises. 64. The nurse tells the client, I am going to refer you to the vocational counselor. The client asks the nurse, why are you making this referral? Which statement is the nurse's best response? 1. The counselor will assist you with job placement, training, or further education. 2. The counselor specializes in rehabilitative medicine and will help you get better. 3. The counselor will help develop your fine motor skills to help perform ADLS. 4. The counselor will help you continue or develop hobbies or interests. 65. The nurse is assessing the client's daily schedule and habits. Which question is most appropriate for the nurse to ask the client? 1. Do you have a family member who can assist you when you go home? 2. What time do you prefer bathing and do you take a tub bath or a shower? 3. Do you have insurance to help with the cost of rehabilitation? 4. Do you have concerns about the care you are receiving here? 66. The nurse is administering medication to the client with a third-degree burn on the chest area. Which medication required a laboratory test? Chapter 9 Integumentary Management 249 Questions 1. The vancomycin medication. 2. The Protonix medication. 3. The Silvadene topical antibiotic. 4. The morphine analgesic. 67. The home health, HH, nurse is arranging for the significant other, of an elderly client diagnosed with heart failure to administer the routine diuretic medication furosemide, Lasix. The medication is to be administered 20 mg on Monday/Wednesday/Friday and 40 mg on Sunday/Tuesday/Thursday/Saturday. The prescription is for 40 mg scored tablets. How many tablets should the nurse teach the SO to administer on Sundays? 68. The home health, HH, nurse has arranged for a home health aide, HHA, to assist a 79-year-old client diagnosed with Alzheimer's disease. Which interventions should the nurse delegate to the HHA? Select all that apply. 1. Weigh the client once a week and document the weight on the patient record. 2. Stay with the client twice a week while the significant other, goes out to run errands. 3. Take and record the client's vital signs. 4. Take the client to the bank and store to perform personal business. 5. Listen to the client's heart sounds and notify the HCP if abnormal sounds are heard. 69. The nurse is at the local mall and a young woman starts having shortness of breath, has hives on her face and arms, and is complaining of itching. Which intervention should the nurse implement first? 1. Tell a bystander to call 911 immediately. 2. Ask the woman if she has an EpiPen. 3. Check the client for a medical alert bracelet. 4. Place a soft cushion under the client's head. 70. The home health, HH, nurse is planning to make rounds for the day. List the order the clients should be seen by priority. 1. The 29-year-old client diagnosed with spinal cord injury, PSI, post, motor vehicle accident, MVA, who needs a dressing changed on a stage 4 pressure area. 2. The 56-year-old client diagnosed with breast cancer who needs an injection of filgrastim, Nupogen, subcutaneously. 3. The 67-year-old client diagnosed with emphysema who called to report that the sputum is a rusty color this morning. 4. The 80-year-old client diagnosed with Alzheimer's disease who is confused and wandering around the house. 5. The 72-year-old client diagnosed with atrial fibrillation who needs a prothrombin time performed and called to the HCP. Client name, AM. Height, 68 inches. Date signature / initials. Account number, 12,223. Weight in pounds, 140. Weight in kg, 63.6. 32301207000. Night nurse RN/NN. Allergies, NKDA. Date of birth, May 9, 1941. 0501 to 2300. Day nurse RN/DN. Medication vancomycin IV PB 500 mg QD. Protonix 40 mg IV PB QD. Silvadene topical ointment to burn TID. Morphine 2 to 5 mg IV PPRN. Pain 0701 to 1500. 250. Prioritization, delegation, and management and of care for the NCLEX-RN registered exam. Ms. Glada is the charge nurse on the 7P to 7A shift for the 10-bed burn unit. There are 3 RNs, Mr. George, Mr. Rob, and Ms. Helen, along with 4 UAPs. There are no LVNs in the burn unit, but there are burn techs, specially trained paraprofessionals who maintain the whirlpool baths. 1. The male client is admitted to the burn unit after a boiling pot of hot water accidentally spilled on his lower legs. The assessment reveals blistered, mottled red skin, and both feet are edematous. Which depth of burn should Mr. George document? 1. Superficial partial thickness. 2. Deep partial thickness. 3. Full thickness. 4. First degree. 2. MR. Rob is caring for a client who experienced a full thickness burn to 65% of the body 12 hours ago. After establishing a patent airway, which nursing intervention is priority for the client? 1. Replace the client's fluids and electrolytes. 2. Prevent the client from developing Curling's ulcers. 3. Implement interventions to prevent infection. 4. Prepare to assist with an escharotomy. 3. Ms. Glada is developing a nursing care plan for a client who experienced a full thickness burn and deep partial thickness burns over half the body 4 days ago. Which client problem should Ms. Glada make priority? 1. High risk for infection. 2. Pain. 3. Impaired physical mobility. 4. Fluid and electrolyte imbalance. 4. Which nursing interventions should be included for the client who has full thickness and deep partial thickness burns to 50% of the body? Select all that apply. 1. Perform meticulous hand hygiene. 2. Screen visitors for infections. 3. Provide a low cholesterol, low protein diet. 4. Change invasive lines once a week. 5. Administer prophylactic antibiotics as prescribed. 5. Which nursing task should Ms. Kathy, the RN, delegate to a UAP for the client with full thickness burns over the right leg? 1. Instruct the UAP to take the client's pulse oximeter reading. 2. Tell the UAP to change the dressing on the right leg. 3. Ask the UAP to apply mefenide acetate, sulfamylin, to the right leg. 4. Request the UAP to complete the admission assessment. 6. Mr. Rob is caring for a client with deep partial thickness and full thickness burns to the chest area. Which of the following assessment data warrant notifying the healthcare provider? 1. The client is complaining of pain rated 9 on 1 to 10 pain scale. 2. The client's pulse oximeter reading is 90%. 3. The client has AT 100.4 degrees Fahrenheit, P100, R24, and BP 102/60. 4. The client's urinary output is 150 ml in 4 hours. Integumentary Clinical Scenario Chapter 9 Integumentary Management 251 Clinical Scenario 7. Ms. Glada is teaching a group of community members about fire safety. A participant asks, "What should I do if I get hot grease burns on my hand?" Which statement is Ms. Glada's best response? 1. Apply an ice pack directly to the hand. 2. Place the hand under cool tap water. 3. Put burn ointment on the hand. 4. Go immediately to the doctor's office. 8. Ms. Glada is teaching a group of new UAPs about burn care. Which information regarding skin care should Ms. Glada emphasize? 1. Keep the skin moist by leaving the skin damp after the bath. 2. Ensure the client is pre-medicated prior to whirlpool. 3. Tell the UAPs to turn the client from side to side at least every 2 hours. 4. Instruct the UAPs to not implement any interventions regarding skincare. 9. Which action by the UAP warrants intervention by Ms. Glada? 1. The UAP decreases the FOR rate of the client whose total parenteral nutrition is almost empty. 2. The UAP elevates the head of the bed for a client who is receiving a continuous tube feeding. 3. The UAP assists the client with full-thickness burns to the upper extremities to eat a high-protein meal. 4. The UAP mixes thicket into the glass of water for a client who has difficulty swallowing. 10. Ms. Glada is caring for clients on the burn unit. After the shift report, which client should Ms. Glada assess first? 1. The client with full and deep partial thickness burns who has pain rated 8 on a 1 to 10 pain scale. 2. The client with full thickness burns who has a urinary output of 120 ml in the past 8 hours. 3. The client with full thickness burns on the chest who is having difficulty breathing. 4. The client who has full thickness burns to the right leg with no palpable pedal pulse. 252. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. The correct answer number and rationale for why it is the correct answer are given in boldface type. Rationales for why the other possible answer options are incorrect also are given, but they are not in boldface type. 1. This client needs assistance being removed from the CPM machine, but it is not priority over a client who needs pain medication prior to a very painful procedure. Equipment is not priority over the client's body. 2. This is a psychosocial need and should be addressed, but it is not priority over a physiological need. 3. This temperature is elevated and the client should be seen, but the nurse should medicate the client going to whirlpool first, then assess this client. Pain is priority over an elevated temperature. 4. The client must be medicated with a narcotic medication prior to being taken to whirlpool, which is a physiological need, therefore, the nurse should see this client first. Content, medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, assessment, client needs, physiological integrity, management of care, cognitive level, analysis. Making nursing decisions. When deciding which client to assess first, the nurse should utilize Maslow's hierarchy of needs, in which physiological needs are priority over psychosocial needs. The alleviation of pain, actual or potential, is a priority need. 2. The client having pain when ambulating after an ORIF of the hip is expected. This client would not need to be assessed first. 2. The client should be ambulating and moving the left leg while in bed and would not need to be in the CPM machine 10 days postoperatively. 3. Numbness and tingling of the legs are signs of possible neurovascular compromise. This client should be assessed first. 4. The client being transferred should be assessed but would be considered stable, therefore, this client would not be assessed before a client experiencing possible neurovascular compromise. Content, medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. Making nursing decisions, the nurse must determine which sign/symptom is not expected for the disease process or surgical procedure. If the sign/symptom is not expected, then the nurse should assess the client first. This type of question is determining if the nurse is knowledgeable of the signs/symptoms of a variety of disease processes. 3.1. An absent pulse is not uncommon in a client diagnosed with arterial occlusive disease. If the client can move the toes and denies tingling or numbness, then no further action should be taken. 2. To identify the location of the pulse, the nurse should use a Doppler device to amplify the sound, but this is not the first intervention if the client is able to move the toes and denies numbness and tingling. 3. Placing the client's leg in a dependent position will increase blood flow and may help the nurse palpate the pulse, but it is not the nurse's first intervention. Forewarming will dilate the arteries and may help the nurse to find the pedal pulse, but this is not the first intervention. Cooling, in contrast, causes vasoconstriction and decreases the ability to palpate the pulse. Content, medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application making nursing decisions. When the question asks which intervention should be implemented first, it means all the options are something a nurse could implement, but only one should be implemented first. The nurse should use the nursing process to determine the appropriate intervention. If the client is in distress, do not assess. If the client is not in distress, then the nurse should assess. 4.1. If the client's international normalized ratio, INR, is elevated, the antidote for the oral anticoagulant warfarin, Coumadin, is vitamin K, but this is not the nurse's first intervention. 2. The client should be using a soft bristle toothbrush, but this is not the nurse's first intervention. 3. The nurse can always check the client's vital signs, but it is not the first intervention when addressing the client's complaint of gums bleeding. Answers and Rationales Chapter 9 Integumentary Management 253-4. The nurse should first check the client's INR to determine whether the bleeding is secondary to an elevated INR level above 3. Content, medical/surgical, category of health alteration, drug administration, integrated processes, nursing process, assessment, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis making nursing decisions. This is an alternate type of question included in the NCLEX-RN registered blueprint. The test taker must be able to read a medication administration record, MAR, be knowledgeable of medications, and be able to make an appropriate decision as to the nurse's most appropriate intervention. 5.1. The nonsteroidal anti-inflammatory drug, NSAID, is a routine medication and is not a priority medication. 2. The client needs to receive the 4 antibiotic but is not priority over the client who is complaining of an acute problem, itching, and hives. 3. The client should receive the antiviral agent but not prior to a client who is exhibiting hives and itching, which is an acute problem. 4. The client with urticaria, hives, and pruritus, itching, is having some type of allergic reaction and should receive the antihistamine first. Content, medical/surgical, category of health alteration, drug administration, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, application making nursing decisions. The client who is exhibiting an acute reaction and/or problem should receive medical treatment first. Routine scheduled medications are not priority over medications addressing acute client needs. 6.1. Corticosteroid cream will not treat potential melanoma, which is what the client is explaining to the nurse. 2. SPF 15 is recommended to help prevent skin cancer but it will not help treat a melanoma. 3. A client should consult his or her HCP immediately if a mole or lesion shows any signs of melanoma asymmetry, border irregularity, color change/variation, and diameter of 6 mm or more, ABCD. 4. Dark, woven clothing helps prevent skin cancer but it will not do anything for a change in a mole. Content, medical/surgical, category of health alteration, integumentary, integrated processes, nursing process, implementation, client needs, health promotion and maintenance, cognitive level, application making nursing decisions. The test taker needs to read all of the options carefully before choosing the option that says, Notify the HCP. If any of the options will provide information the HCP needs to know in order to make a decision, the test taker should choose that option. If, however, the HCP does not need any additional information to make a decision and the nurse suspects the condition is serious or life-threatening, the priority intervention is to call the HCP. 7.1. The nurse should implement the first intervention, ensuring the client does not move the leg, because doing so may cause further injury. The client should not attempt to move or stand on the injured extremity. 2. The client should elevate the leg to decrease edema, but it is not the first intervention. Remember to do no harm. 3. The application of ice will help decrease edema and pain, but the first intervention is to do no harm. 4. Assessment is usually the first intervention, but when at the scene of an accident, the nurse should ensure the client does not cause further injury prior to assessing the client. Content: medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application. Making nursing decisions, the nurse should use nursing process when answering questions that ask which intervention to implement first. Assessment is the first step in the nursing process, but in an emergency situation, remember the nurse should ensure the client does not further injure himself or herself. 8.1. The nurse should obtain the needed equipment, but that is not the first intervention. 2. The nurse should remove the old dressing with non-sterile gloves, but not before determining whether the client has been pre-medicated. 3. The nurse should explain the procedure prior to performing the dressing change, but that is not the first intervention. 4. Dressing changes for a stage 3 pressure ulcer will be painful for the client, and the nurse should make sure the client has received pain medication at least 30 minutes prior to the procedure. This is showing client advocacy. Content: medical/surgical, category of health alteration, integumentary, integrated processes, nursing process, implementation, client needs, physiological integrity, basic care and comfort, cognitive level, application. Answers 254. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. Making nursing decisions, there will be management questions on the NCLEX-RN registered addressing client advocacy. A client advocate acts as a liaison between clients and healthcare providers to help improve or maintain a high quality of health care. 9.1. The HNH is low, which requires the nurse to assess this client first. The nurse must take the client's vital signs, check the surgical dressing, and determine whether the client is symptomatic for hypovolemia. 2. The client with rheumatoid arthritis should have a positive rheumatoid factor, RF. The positive RF factor confirms the diagnosis of this disease process. 3. A client with a stage 4 pressure ulcer would frequently have an infection. Therefore, the nurse would expect an elevated white blood cell, WBC, count. 4. Corticosteroids elevate the client's glucose level, therefore, the nurse would not assess this client first. Content: medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. Making nursing decisions, the nurse must be knowledgeable of normal laboratory values. These values must be memorized, and the nurse must be able to determine if the laboratory value is normal for the client's disease process or medications the client is taking. 10.1. The nurse should complete a report documenting the client's fall, but this is not the first intervention. 2. The nurse should notify the clinical manager, but this is not the nurse's first intervention. 3. The nurse must first determine whether the client has any injuries before taking any other action. This is the first intervention the nurse must implement prior to moving the client. 4. The nurse should determine why the client was ambulating alone, but it is not the priority nursing intervention. Determining whether the client has any injuries is the most important intervention. Content, medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. Making nursing decisions, assessment is the first step of the nursing process, and the test taker should use the nursing process or some other systematic process to assist in determining priorities. 11.1. The triple lumen lines should be flushed with 100 units/ml of heparin solution, and this task should not be delegated to a UAP. 2. This is teaching, and the nurse should not delegate teaching to the client. 3. The UAP can assist the client to the bathroom as part of the bowel training. The nurse is responsible for the training, but the nurse can delegate this task. 4. Corticosteroid cream is a medication and the nurse cannot delegate medication to a UAP. Content, medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis. Making nursing decisions, the nurse cannot delegate assessment, evaluation, teaching, administering medications, or an unstable client to a UAP. 12.1. Because the UAP is informing the nurse of pertinent information, the nurse should assess the client to determine which action to take. 2. The client may be hemorrhaging. Therefore, the nurse cannot delegate assessing vital signs on an unstable client. 3. The nurse should not remove the dressing. The nurse should reinforce the dressing and notify the HCP if bleeding does not stop or if the client is showing signs of hypovolemia. Reinforcing the dressing would help decrease bleeding, but the nurse must assess first. 4. The client is potentially unstable, therefore, the nurse should not delegate any care to the UAP. Content, medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application. Making nursing decisions, anytime the nurse receives information from another staff member about a client who may be experiencing a complication, the nurse must assess the client. The nurse should not make decisions about a client's needs based on another staff member's information. 13.1. Tying a client to a chair is a form of restraint, and the client cannot be restrained without an HCP order, therefore, the nurse should immediately free the client. This is a legal issue. Chapter 9 Integumentary Management 255-2. The UAP is not hired to smoke with the client and the nurse should talk to the UAP, but this does not warrant an immediate response. The client being illegally restrained warrants immediate intervention. 3. Bringing a beverage to the client would not warrant immediate intervention. 4. The UAP can assist the client to ambulate. Content, medical/surgical, category of health alteration, management, integrated processes, nursing process, implementation, client needs, physiological integrity, safety and infection control, cognitive level, application. Making nursing decisions, delegation means the nurse is responsible for the UAP's actions and performance. The nurse must correct the UAP's performance to ensure the client is cared for safely and legally in the hospital or the home. 14.1. Tinea corporis is commonly known as ringworm and should have cool compresses applied, not warm compresses. 2. The LPN can apply medication to the client